Hi viewers, I am talking about psychology in physiotherapy. Psychology in physiotherapy. Mainly we want to study psychology in physiotherapy for basically on assessment part. Assessment part we need the psychological health also is needed for doing physiotherapy in patient. Okay, mainly in psychology, for what purpose we are using psychology in physiotherapy? That's the one question. Okay, why you people are studying psychology in physiotherapy? For what reason? For mainly for assessing the patient's mental health. If the mental health is okay, we can do exercises too. We can give prescriptions to the patient. Okay. Now, in psychology, we want to study about how to apply in the patient's life, because how to apply psychologically we want to approach the patients for know more about objective and subjective assessment we want to know. Then after that, if the psychologically well patient we want to approach like that, otherwise we want to do some relaxation technique and all things. Okay, our prescription is based on the psychological health, so we need to know the conditions related to the patient. Okay, the founder of psychology is William Worth in 1879. Basically, William Worth is the one of who has developed the psychology in 1879. Mainly the introduction of psychology, one of the topic in our university exam. They are asking some questions from introduction of psychology. Mainly in that, what is psychology we want to tell. Okay, we want to write what is psychology, the definition of psychology, the hope of psychology of the human and the animal behavior. It includes the application of the science to human problems, because mainly the psychology is using to know the behavior of human behavior, how to behave the human. Okay, behavior of the human being, that we want to know. What are problems? Some people have only psychological problems, not they have no physical problems. They feel pain because due to the psychological illness. Okay, that's why we want to know. The main definition of this psychology is a science. Okay, the psychology is a science. Science means what? In that everything is there. The science, every theoretical part is there, practical part is there. In science, it's mainly based on this both. Okay, so in the practical part is more difficult in psychology, because theory we can read in from books, but its application of these theories are very difficult, because in each person by person, this theory application of this theory is very different. Okay, then mainly this definition is divided into two parts. First part is psychology is a science, second part is application in really life. These two part is the main difficulty. So application of the psychology is a science. In that things comes under that science part is mainly the theories. We want to study lot of theories in psychology. In physiotherapy we have theories of psychology is a 10 mark question. Okay, then how to apply the psychology in daily life, that is the main risk part of a physiotherapist. Because physiotherapist, psychologist, everyone has a healthcare professional. We want to a risk part, how to apply the psychology in real life, how to do assessment. That's the main part, because the patient has whether the psychological problem or physical problem, we want to know more. Okay, then the application of psychology comes under experimental method and systematic method. This method, two methods, I will tell you in next class. In this class, we will study about experimental method and systematic method. Two methods are there for the application of psychology. Okay. Then this much you can understand what is the definition of psychology. Definition, mainly the definition is psychology is a science, that is the psychology is a science of human and animal behavior, how to behave in society. That is the main problem. Okay, if we can't tell any person is abnormal or normal because of his behavior, we can't tell. Okay, we want to do some experiments, we want to apply some theories to their life. In that time we can understand whether the person is normal or not, because there are some people have more stress. For more stress, they started with the joint pain and all. Then we will confused whether the if we are giving pain relieving modality 7 for 14 days or 7 days, then the patient is telling still I have pain on the joint, then what to do? Because we want to do some placebo effect also, then we want to heal their mind also. Physiotherapy means we want to heal their mind and body. Okay, so we want to study these all things. The psychology is one of the dry subject, so people stay tuned and to our video. These videos are very useful for you. Then please subscribe my channel and press the bell icon for further videos. Thank you.